Welcome, folks, to the My Black Diabetes Meal Plan podcast. I'm Dr. Sean Smith. I'm joined today, once again, with Dr. Joel Fuhrman, world-renowned physician, one of my favorite people to speak to. And our goal in this podcast is to get the facts clear on type 2 diabetes so that living with it is completely optional. And folks, if you love this type of content, if you love this type of shared time with Dr. Fuhrman, be sure to like, share, and subscribe this video and share it with other folks. Dr. Fuhrman, how are you today?
Doing great. Having lots of fun.
Excellent, excellent, excellent. You know, there's a couple of things that I wanted to jump into today. And the first is really about some comments that we've been kind of getting from on some of the videos. And then I want to jump into a conversation about nutrition principles. It's my belief that if people can reason from sound nutrition principles, they're going to be able to make better decisions, higher quality decisions throughout their day when it comes to the type of food that they're eating. And so to that end, I've got a question here from Nick Seifert. Let me see if I can pull up his YouTube comment here. So Nick Seifert is he's made a comment on the video. He says, just found your channel. It's great information. Have you had a chance to talk about intermittent fasting with Dr. Fuhrman? More specifically, can you discuss the OMAD eating plan with Dr. Fuhrman? That is what I'm doing right now while eating a nutritarian lifestyle. I'm curious to hear your thoughts and the doctor's thoughts on the topic. Okay, so are you familiar with this OMAD diet situation here?
I don't think so. Can you refresh my memory?
You got it. Yeah. So with the OMAD, we can really handle this question in two parts. The OMAD diet is an acronym. Okay, so it stands for 1 meal a day, right? So OMAD, 1 meal a day. It's a type of intermittent fasting diet plan where the idea is to limit your eating window throughout the day to just once a day so that you give your body time to reset insulin levels and burn excess calories. And so, you know, ketosis is all the rage. Everyone's trying to get their body into a state of ketosis because that's, you know, the trend right now. And so the OMAD diet is something that can help you to do that as the belief goes. And so maybe we'll start there with the OMAD diet, this idea of 1 meal a day. Is it possible? Generally, people like it because you can eat what you want when you want, as long as it's within your scheduled meal time, right? So you have like a 1 hour feeding time, right? If approached the right way, do you believe something like the OMAD diet is helpful to people fighting diabetes?
Well, it might be helpful for some people fighting diabetes, but it doesn't work well for everybody with the 1 meal a day plan. The problem with it, like, let's take myself, for example, or you know, I'm taking my dog and I'm climbing mountains, or I'm running on the beach, or I'm going playing I'm doing a lot of physically exerting sports. If I tried to get my needed calories in on 1 meal a day, I'd have to overeat and swell my stomach out to a point of being a little stretched and full. And you don't digest well when you eat till be too full. If I was a 100-pound woman with a low caloric need and not that physically active, then 1 meal a day would give her sufficient calories, so she wouldn't have to overeat on that 1 meal to achieve her total caloric load. We usually for people who want to intermittent fast, we go to 2 meals a day. And with athletic people and highly physically active people, we find they do better on 3 meals a day because they're not eating till they're so stuffed to get that 1 meal a day in, you know. And of course, I just want to say one of the major factors in the benefit is eating a lighter and earlier dinner. So you have that 14-hour window between the end of dinner and the start of breakfast for intermittent fasting. But also just eating a lighter dinner helps too, where you really feel you're going to bed a little hungry. But so the answer is, you know, I don't know that there's going to be so much more of a benefit if you took the total calories a person consumed for the day. Let's say they were consuming 1,300 calories a day, and you shove those 1,300 calories in at one time versus splitting them into 2 meals. My preference would be to split them into 2 meals because you could chew better, you could eat more roughage, you could eat more bulky foods and lower calorie, high nutrient foods. When you go to the 1 meal a day, because you only have a liter of a stomach, you have to eat more concentrated calories. and more foods that aren't as healthy sometimes to get all the calories in you need. So therefore, I'm a little bit, so that you do have to pay attention to the right food, the most nutrient rich anti-cancer foods, which are often high in fiber, bulky, low in calories. I want people to eat lots of salad, lots of green vegetables, peppers, onions, jicama, mushrooms. When you're eating all these high volume, low calorie foods, you could fill yourself up too easily. And for me, I would feel a little uncomfortable trying to get all the calories in at once.
Right, right. And we've been talking about the OMAD diet. I think I've taken it for granted that people know what intermittent fasting is. Right.
Yeah.
And so maybe we could back up just a step and answer that question, which is what is intermittent fasting? Is it helpful? Why is it helpful? And particularly, why would it be helpful for someone with type 2 diabetes?
Right. So the concept is good. The concept is good that people have a tendency to eat all day long. They snack, they eat late at night. And we know that the body needs time. We call it the catabolic phase, where you're breaking down stored reserves for energy. And when you're breaking that, as opposed to getting energy from the food that's being digested, when the calories are being in your digestive tract coming in, that's the anabolic phase. You're adding calories to your body. But when you're taking in the catabolic phase, that means digestion has finished. There's no calories passing from the digestive tract into the bloodstream anymore. And now we're utilizing calories that was stored when we filled up our gas tanks. And the stored calories could be fat, could be glycogen, could even be muscle tissue. But the body is detoxifying, healing, and repairing more efficiently in the catabolic phase of the digestive cycle compared to the anabolic phase. When you're in the anabolic phase, the body is storing away nutrients, it's turning glucose into glycogen, the liver is busy shunting materials into storage sites. In the catabolic phase, we're breaking down that glycogen, and in the process of breaking down both fat and glycogen, we're releasing stored toxins. The liver is then involved in deconjugating fat-soluble toxins and make them water-soluble for excretion in the kidney or the sweat, or even breathing them out. So the body has enhanced its detoxification channels. When we sleep at night and rest in sleep, we're reducing free radicals in the brain. And the body can more effectively do that in the sleeping stage. And it can more effectively do that if we're not digesting food simultaneously when we're in the sleeping stage. And we think that there are metabolic advances and also longevity advances to having a longer period when you're sleeping and in the catabolic phase. That means you don't benefit from intermittent fasting if you eat a late dinner, go to bed on a heavy stomach, and then skip breakfast and don't eat till 3 o'clock in the afternoon the next day. That's not going to give you much benefit because you didn't sleep in the catabolic phase. You slept in an anabolic phase. We were digesting food all night long. The real benefits of intermittent fasting are reaped when you go to bed a little, where you're eating earlier in the day, where you're actually stacking your calories, maybe eating breakfast and lunch and skipping dinner, or you're eating not by eating, so you're not eating late at night. So this is the opposite of what they do in most European countries, where they go out and they eat dinner at 9 o'clock at night, come home and go to bed on a heavy stomach. Right? We're telling people to stack, because your body's more metabolically active in the morning. We say a calorie at night is like 2 calories in the morning, because it's more likely to be stored as fat. So a calorie consumed in the evening counts as 2 calories because it's more likely to store it as fat because you're not utilizing it for energy. And your body is metabolically more active at burning more calories earlier in the day. So there's a lot of factors that make intermittent fasting a benefit, but a lot of those factors aren't just how long you're not eating. It's what time of day you're eating, and that you're sleeping at. And the most important thing is not to reflux food up into your throat when you're sleeping at night and you're lying flat. You shouldn't have any food refluxing up. The digestive tract all the food should be down in your large intestines by then. You know what I mean? And so we should really, again, so the 1 meal a day plan, where if a person eats around, in the morning or midday, that would work out well, but I wouldn't want a 1 meal a day plan where they eat late at night.
Right. Okay. So we're hearing you say that, just to clarify for folks, intermittent fasting is a general type of approach to scheduling your food, eating your meals throughout the day. The OMAD diet is a particular species of intermittent fasting, right? And so what the doc is saying is that it might help if you're very small, you don't need a lot of calories, but if you do need a lot of calories, you like eating, and you're also A person that's more active, the OMAD diet, Nick, might not be the thing that you'd want to be on. But in either case, you definitely want to make sure that you're paying attention to the quality of food that you're getting if you are just going to have one meal, right? You really can't afford to mess it up. But there's one thing that you just said, Doc, that is really fascinating to me. I've never heard anyone say, look, if you eat a heavy meal at 11 and then you don't eat again till 3 p.m. in the next day, that's not particularly helpful. Can you help me understand why something like intermittent fasting is specifically useful for someone who has type 2 in terms of controlling their blood sugar?
Right. Well, it all has to do with insulin resistance. We know the longest lived people are insulin sensitive, not insulin resistant. And as you so the fat on the body makes you insulin resistant, and body's stores of saturated fat distort the shape of the insulin receptor and make it not work as well too. Your body, in the first phase of the digestive cycle, when your body is eating up the stored glycogen, let's say you're eating the meal and you're burning up glucose as you're storing it for energy and whatever calories you ate, because that's still the anabolic phase. Then there's no more calories coming in. Then what is your body burning for energy when there's no calories coming in? It's not burning fat that efficiently when there's no more calories coming in. It's burning the stored glycogen. The body stores the extra glucose that you didn't eat, that you didn't burn off as glycogen. So in the first phase of the beginning part of the catabolic phase, you're not going to burn more body fat, or you're not going to reduce the insulin receptor, increase insulin sensitivity, and heal the insulin receptors and melt much fat off your body, because your body is just going to more readily and easily burn the glycogen that was just most recently stored. The most recent stored glycogen is what you burn first. And then when the glycogen stores start to be depleted, then your body starts to burn more fat stores. So when you have a larger space of time between meals, it's in the second phase of the catabolic phase, where your glycogen stores start to decrease, that your body more effectively can enhance insulin sensitivity and burn more fat off the body at the same time and do more repair. Because the fat supply is where most toxins and free radicals are stored, and fat cells also spew out lipokines and other inflammatory substances that make diabetes worse. So you're having more diabetic reversal, more body repair, and you have a pro-diabetic meal or a phase and an anti-diabetic phase, and it's the later half of the catabolic phase that's anti-diabetic. So we can give more time between meals. Finish dinner early, don't eat breakfast till 8 o'clock, finish eating dinner by 6 o'clock. That's a 14-hour window. It's going to be much better for your diabetes control than if you had a 10-hour window. That extra 4 hours makes a big difference in the body able to burn fat.
Okay, so is there a particular window in time that is optimal throughout the day? So we have a 24-hour schedule here. We know 8 hours is going to be eaten up by sleeping. Sleep is so important, folks, right? So part of it is because of this reason. But I'm hearing you say, look, too late. Even if you get 14 hours, it doesn't make much difference if you stop eating at midnight, right? You stop eating at midnight and then you go to 2 the next day. That's 14, but you're still not getting the optimal benefit. So what window in time does procure the optimal benefit? When can we get the best?
When you finish eating dinner at least 4 hours before bedtime.
I got you.
So that's really, you want to get that. So the 14 hours occurs between the end of dinner and the start of breakfast. But you realize when you finish dinner at 6 o'clock, you're still digesting food till 9 or 10 o'clock, till 9 o'clock at night. So you didn't really hit the catabolic phase then. So that's why we don't want to go, and you can still be into the anabolic phase if you eat a heavy dinner with too much volume. If your dinner's too big and you're overeating at dinner, that particularly could make things worse, and you won't even hit you won't get the full benefit from intermittent fasting. So it's eating a later dinner. I'm just going to 1 second.
Sure.
My wife left her watch here, and it's going her new iWatch, but of course it makes noise like a phone when it goes off.
Of course.
She's at the gym. Anyway, so you don't get the full benefit. Like sometimes I'm not perfect. That one of my, I had a dinner and the dessert was like so good. I had a second dessert. I had overate a little bit. And I'm saying to myself, I finished dinner by 6 o'clock, but it's like 10 o'clock at night and I still feel I have food in my digestive tract. I really overate tonight. I shouldn't be doing that. I got to watch myself. That's not good for me to, I want to feel empty, even a little touch hungry sometimes when I go to bed. There's an art to like controlling your time of when you're eating and also how much you eat. And you're controlling your body weight. You don't want to get too thin, but you want to be as lean as possible without getting too thin. You know what I mean? So I was here. So I had this guy came in yesterday. He wasn't really that overweight, but he was eating so much of the healthy food, so much, but like huge amounts. And I said, when you eat that much food at one time, you're not going to digest that in time to go to bed because it's just too much food. And also, you're stretching out your stomach so far and eating until you're so full, you have poor digestive efficiency. You'll get more fermentation, more production, less beneficial effects on your gastrointestinal microbiome. You're going to have too much, fermentation going on and bacterial overgrowth. I'm trying to get so much food, being so full, eating all that food. Try to eat a reasonable amount of food. And I said to him, how is your kidney feeling today, by the way? He said, I don't feel my kidney at all. I said, how's your pancreas feeling? I don't feel my pancreas. And how's your liver feeling? So the point was, you shouldn't feel you have a stomach. You should chew really well, and stop eating and get up from the table before you felt discomfort from your stomach, or you felt it swelled, or you're uncomfortable. Why not go for a walk, or, don't try to stop eating before you get overly stuffed yourself. And we're us health nuts are trying to be as healthy and live as long as possible, are trying to maintain the perfect body weight, the perfect body fat, picking the right foods, picking the right amount of foods, picking the right timing of the food. And I said to him, we're going to dinner now. We just were coming back from the dog beach. He came with me to the dog beach to watch my dog run around. And we had a lot of fun. And we're coming back, and I said to him, wow, it's like 4:30. We're going to dinner at 5. And I'm really starving. I'm hungry, because I only had the salad and the soup at lunch. I said, but you ate double the amount of food I ate at lunch. Are you hungry now? He said, no, I'm not hungry at all. And I said, that's the thing, is that I'm trying to judge the size of my lunch. So I'm hungry before dinner. So I'm really dying to eat dinner at 5 o'clock. If you're not dying to eat at 5 o'clock, then you overate at lunch. So how much did you eat at dinner time? And if you're not by 8 o'clock in the morning, if you're like dying to eat breakfast, almost starving for breakfast, dying to be hungry, then you overate at dinner. Try to take that art of judging how much you eat and what you eat. So you really feel you need the food when you're eating it. You couldn't even go an hour longer. You're so hungry. Mm. And if you eat too much at one meal, then the next meal is overeating, because you really hadn't utilized the calories from that meal. If you're not hungry, you're not ready to eat the next meal. So the combination of eating less frequently, but also, if you're eating 2 meals a day or 3 meals a day, making sure the volume of what you're eating is correct, that you're hungry for the next meal, and you're making sure that if you're overweight, you're losing weight. And if you're not, and so for me, I'm not overweight, but I might still have a tendency sometimes just to overeat once in a while. If it tastes so good and it's recreational, I'm still watching myself who's not overweight, because I know regardless of my weight, I want to be in great health, and overeating is going to shorten my lifespan.
Wow. Folks, you're getting it straight from the doc. In some ways, I can feel that somebody's watching right now and being like, geez, there's all of these rules, right? There's all of these things that I have to go through, right? Like I can hear it. I'm like, oh man, listen, we are not suggesting for you that there's just all of these different rules. What we're saying is that if you can make yourself a priority, right, then all of these 100,000 different rules really can get boiled down into simple principles. One of those is paying attention to the body. And as Dr. Fuhrman has just let us know, you shouldn't even feel like you have a stomach. You shouldn't be feeling pain in your pancreas. You shouldn't be feeling all of this tension inside of your body when you're eating the right food and you're eating it at the right time of day, right? And so being able to calibrate your system so that you're able to pay enough attention to yourself and you're able to know what feels great, that's a part of what we're talking about today. And to that end, there's actually another comment here that I really wanted to get laid down. Is this one's coming from June Swami. And folks, if you ever have a question for Dr. Fuhrman, leave them in the comments. And in fact, while you're there, be sure to like, share, and subscribe this video so that we can take this information, your questions, to the doc, and he's able to answer. And so June Swami says, very good information. would like to know more of migraine headaches. And so I basically taken her question, and I want to make sure I can build it out a little bit for her, which is that it seems that migraine headaches, like other ailments, have a root in dietary choices. And so that would be my assumption. But my question is two-part. What causes migraines, and are there choices we can make in the kitchen that would help to limit some of these headaches?
Right. And, that's been really my specialty throughout my 35-year, medical career, is that.
That's your specialty? We've been talking about diabetes. You're saying you have another specialty on top of
I'm
type
saying
2?
my specialty is dealing with people's medical conditions, and having them reverse without needing medications, right? Reversing these diseases without getting them off their drugs. And understanding headaches is a key factor to even understanding how the body works and how to get rid of your diabetes. If you don't understand the process of headaches, you're not going to be good at your getting rid of your diabetes. Because what I'm saying here is that feeling worse is getting better, and feeling better is getting worse. So if I can give you a drug for your headache, Esket, Wygain, Vanquish, Excedrin, Furanil, Furacet, Midrin, whose active ingredients are barbiturates, narcotics, and caffeine. We're stopping the headache itself is the right directed activity to remove toxins from the central nervous system. And you're inflamed because your body is toxic and has too much free radical production. And so when the body starts to have a cascade of maybe more rest, maybe even eating right, maybe stopping the caffeine, maybe eating healthier, your body can utilize the extra effort and energy to try to do deeper cleaning, and it can precipitate a headache, which is getting rid of toxins out of the body. Now, we can take a Tylenol or a medication to stop the body from detoxifying, or the cascade of the avalanche of inflammation. Remember, we learn in the medical textbook that doctors learn from Robbins and Cochrane that the I'm quoting from Robbins and Cochrane, that book.
Okay, these are
the
authors.
Inflammatory response is closely intertwined with the process of repair. Inflammation serves to remove, address, and wall off the injurious agent, but in turn sets into motion a series of events that tries to heal and reconstitute damaged tissue. So I'm defining what inflammation means by this pathology book that all medical students read. What I'm suggesting right now is that making a headache go away by taking a drug is making you sicker, and the headache's now going to come back, going to rebound back again. And the more people take headache relief medications, the more they take aspirin and pop Tylenol, the more they turn their occasional headache into a chronic migraine syndrome now. And now then they can even have daily headaches and require prophylactic and more drugs. And it gets to a point in my career where I have a person let's say I have this 19-year-old who's out of school, out of college, can't get out of bed with headaches every day, in a hospital getting emergency IV treatment for her daily headaches because she medicated the other headaches away and the doctors were so freely giving the drugs. I get these people but I get them well, but it's not that they never have a headache again. We've got to take them off slow, get them eating right, get their body detoxifying, get rid of the toxins, and then gradually come off the drugs. And now when they start to have headaches that are milder, we're using ice, massage, sometimes, some other pain modalities are not drug modalities. It could be, electric stim but in any case, we're getting them off their medications, and we're letting them not medicate their headaches. So the detox week, that first week, they're coming off their drugs and we're getting their bodies healthier. They can feel a little worse, but then they're going to get rid of their headaches and never have a headache the rest of their life. So the person who comes into my retreat drinking 10 cups of coffee a day or 5 cups of coffee a day is going to have headaches from stopping the coffee. If you're coming off cigarettes or cocaine or alcohol or coffee, you're going to feel worse when you try to eat healthy, or you're just going from an unhealthy diet to a super healthy diet. You're not going to feel better right away. You're going to feel a little worse. The headache is representative of a type of worsening that you could feel when you improve your health. You could feel worse when you improve your health as you enhance detoxification. And when they come into my retreat here, we tell them, don't take Tylenol, don't take aspirin, don't worry about feeling weaker and more headachy the first week. It's going to go away by the day 5. It's part of the healing process. And that's why we're not giving you any caffeine here, because we want this stuff to get out of your system so we can be in touch instinctually with how the body feels. And now you can really not have things recur again. And also, people mistake that for hunger. They think headachy and stomach cramping and feeling fatigued are hunger, and they eat to relieve the headache and the fatigue. And they overeat to try to do it because the overeating stops the detox process. So what I'm saying, it relates to diabetes in a way, Because unless people understand that detoxing and feeling worse is actually beneficial, and not to be, you're going to have trouble getting down to the right amount of calories because you're never going to be in touch with instinctual hunger, and you're not going to know how your body feels without addictive withdrawal, because headaches are a form of addictive withdrawal from unhealthy habits.
Okay, so a lot of big game that the doctors gave us, like this idea of would you call that instinctual hunger? Is that what you said? Instinctual hunger, instinctual craving?
Yes, that when the headache was withdrawal hunger. I call that
Like
what's
a
it
fake
called?
hunger.
Toxic. I call it toxic hunger,
Yeah.
because you're withdrawing from a toxin, and the eating or drinking relieves the pain. So you think it's hunger. So people think, oh, I'm buzzed with a headache, I must need food, because food relieves it. So they think so, or they want to overeat now because they feel fatigued, shaky, irritable, headachy, stomach cramping. Those are toxic withdrawal symptoms from an unhealthy diet or from chronic overeating. And they think that feeling whatever makes them feel better is good for them, so it's good to eat, and they think that's hunger. Once we get them well enough to have those things not happen anymore, then they have the opportunity to be in touch with what real hunger feels like.
That's
and
right.
Now, and that's the instinctual, natural hunger that directs you to eat the right amount of calories.
Right.
That's why, unless you eat healthy enough, your body is not giving you the proper hunger signals to, you become this calorie consuming monster because your diet's not healthy, and you have to eat more food just to keep your energy up, just to feel okay. Right. But once you're really healthy, you're comfortable with less calories, and then hunger becomes a different sensation. It becomes a milder sensation that you feel in the between your upper part of your chest and your neck, right in this area of your body.
This is beautiful. Folks, if there's one principle that we can pull from Dr. Fuhrman's words right now, the principle is do the work, right? What he's saying is that if, just like if you were in physical therapy, you got in a car accident and you broke your legs, right? The physical therapy to get your legs back to health is going to hurt. It's likely going to be some pain involved, not because that's natural to you, but because there was already so much damage that was caused given your previous behavior, that the work that's required in order to get back to normal is going to hurt a bit. I really enjoy that. And so the idea, the principle here for us is just do the work. If you're willing to do the work to actually get quality nutrition and quality health, you're going to see incredible benefits. And so, Doc, we've got to go ahead and run here. But as we continue, really this focus on nutrition principles, and you're dropping so many for us that it's incredible. That's really what I want folks to be able to take away. And folks, if you're serious about losing weight and getting off medications, we're including Dr. Fuhrman's T20 program with each subscription. Dr. Fuhrman's T20 diabetes meal plan is a godsend. It's going to be an added benefit for any of those folks who come on board. Dr. Fuhrman has worked with thousands of patients, and 90% who follow his recommendations can get off insulin within a month. And so we want you to be next. Go to myblackdiabetesmealplan.com and get started with the free assessment. Dr. Fuhrman, I thank you so much for joining today. I cannot wait for more great conversations. We'll talk soon. Have a great day.
Hey, take care. Bye, everybody.